Hey, what's going on? Dr. Trevor Miner, physical therapist here. Today we're going to be talking about my top 5 tips for completing the OASIS Start of Care. For those that don't know what the OASIS Start of Care is, it's the comprehensive assessment done by the first person that sees a patient in home health under Medicare Part A. Okay, so it's an assessment that covers body systems, personal supports, medications, just basically anything in a patient's medical or social history that could impact their health or well-being. Now, before we get into that, if you're new here, please consider subscribing to the channel. I really would appreciate that. And with that being said, let's get started. Tip number 1, when you're going to schedule your patient for that start of care visit, which you'll typically be doing the day or the night before the visit, you're going to want to ask them to prepare a few different things to speed up that process when you're in the home. So those things include their insurance card, medications, not just a list of medications, but the actual physical medications, including over-the-counter medications if they have those or use those, vaccinations, a living will if they happen to have that, a medical power of attorney. If they have that as well, they want the information for that person. And then also, if they have a DNR or do not resuscitate order, you want that information ready and available when you show up. The other thing that I like to ask is, or to confirm, is who their primary care physician is and when the last time they saw that person was, and also the next scheduled visit, because that's going to be important. Typically, the primary care physician is the following physician for the home health episode, which is a necessary requirement for the episode. So, as that starting physician doing that initial assessment, you are responsible to make sure that that physician is known and that they complete that follow-up visit in order to meet Medicare guidelines. Now, that won't always be their primary care, the following physician. Sometimes a cardiologist or an ortho might be the following physician, and that's fine, but you want to find that information out as quickly as possible, or have them at least thinking about that and preparing what they have available. Number 2, you're going to want to do a very thorough chart review. I like to do this the morning of the visit, so before I go on that same day, so it's fresh in my mind. But during that review, of course, you're going to be taking some notes. You really want to get a good understanding of exactly what's going on with them, what their prior level of function was, where they were, what hospitals and rehab facilities they were in, and how long they were in those facilities, and then if anything kind of happened while they were in those facilities. In addition to that, if you happen to see a height and weight that was taken recently, you can also make note of that. That'll help to fill out your Start of Care OASIS much quicker. Tip number 3. Now, when you go to the actual visit, the first thing that I like to do is I like to take 3 to 5 minutes, sometimes a little bit more if necessary, but really get to know the person in front of me. So the human being that I'm meeting with, I want to understand them. I want to know what their goals are, what their desires are, what makes them motivated. What do they dislike? Have they had bad experiences with therapy in the past, or have they had good experiences? I want to really understand them. So I like to call that like building a relationship of trust. So I like to spend 3 to 5 minutes to build that relationship, get to understand them. And not only is that going to help with filling out the OASIS, but it's also going to aid in your plan of care and knowing exactly how you need to motivate that patient so that they can be successful. Tip number 4, as soon as you are done kind of building that good foundational relationship with your patient, you immediately want to get those consents filled out and get all those medications entered into the chart as quickly as possible. Now, because you've previously asked for all the information that you need for those things, it should happen really quickly. And the more you practice, the faster and faster you're going to be able to do this key part. Now, my 5th and final tip, this is something that should be just common sense, but I know that it sometimes doesn't happen. I've seen it not happen at times. You need to actually assess the mobility and the function of the patient Okay, so we can refer to this as an OASIS walk. In other words, you're asking the patient, depending on their level, if they're ambulatory, then asking the patient to get up and to go into the bedroom and get in and out of the bed, get in and out of the shower, on and off of the toilet, show how they can, undo the buttons on their shirt, or put on shoes, socks, those types of things, so that you can actually properly assess the level of function of the patient. Now, some patients certainly will be much lower level, and it's really easy to cross a bunch of things off the list. But if that's not the case, you really want a good understanding so that you can properly answer those OASIS questions. Okay, that's it. Those are my top 5 tips for completing the OASIS Start of Care. Now, I do have one kind of bonus item. I created an OASIS Start of Care cheat sheet. I'm going to link that down below. It's totally free, and it essentially is one page that includes almost all the information from the OASIS. In other words, if you complete everything on that page, you should be able to go into the OASIS document on your EMR and fill everything out really, really quickly. Now, like I said, it doesn't include every single thing, but the things that aren't included should be pretty easy to answer if you've done the whole assessment. And that is all. So thank you for watching today, and I hope to talk to you guys in the next one. Have a good one.